Hi, I'm Dr. Alex Carter, and I'm so glad you're here. Summer is a beautiful time of year, but for those of us over 50, it can also be a season when our hearts need a little extra care. Today, I want to talk with you about something that a lot of people don't realize. Heat doesn't just make you uncomfortable, it can actually put real stress on your heart. 1 in 4 seniors ends up in the emergency room during the hottest months without fully understanding why their body is acting differently. The good news? If you know what to look for, you can catch these warning signs early and stay safe. Let me explain what happens inside your body when the weather gets hot. Your heart is an incredible pump, but it's also very sensitive to changes in temperature. When the temperature rises, your blood vessels dilate to bring more blood to the surface of your skin so you can cool down. This is your body's way of regulating itself, but it means your heart has to work harder. It's pumping the same amount of blood through wider vessels, and it has to maintain your blood pressure at the same time. For younger people, this adjustment happens almost automatically, and they hardly notice it. But for those of us over 50, the process isn't as smooth. Our bodies change as we age. We sweat less efficiently, which means we don't cool down as quickly. Many of us are also taking medications, blood pressure medications, beta blockers, water pills, and some of these interfere with how our bodies respond to heat. Additionally, dehydration becomes a bigger risk because we don't feel thirsty the same way we used to. When you combine all of these factors, you can see why heat puts extra stress on the heart. And that stress, it sends signals. 5 specific warning signs that I want you to know about. And the last one might surprise you, so stick around to hear it. Let's start with warning sign number 1, unusual shortness of breath. Now, if you climb a flight of stairs on a hot day, sure, you might feel a little out of breath. That's normal. But I'm talking about shortness of breath that shows up at rest, or that's much worse than usual. Picture this. You're sitting in an air-conditioned room. You're not doing anything strenuous, and suddenly you feel like you can't quite catch your breath. Or maybe you notice it when you're walking to the mailbox, something you do every day. But today, for the first time, it feels much harder. That's a warning sign worth paying attention to. What's happening is that heat causes your heart to work harder, and when your heart isn't keeping up with the demand, fluid can back up into your lungs. This is different from being out of shape or overweight, though those things matter too. This is your heart specifically struggling with the heat. The shortness of breath might come and go, or it might stick around for an hour or more. If you experience this, especially if it's new for you, that's the time to get to a cool place, drink some water, and if it doesn't improve within 15 or 20 minutes, call your doctor. Don't wait for it to go away on its own. Your body is talking to you, and it's important to listen. Now, the second warning sign is just as important, and it's something I want you to know the full story about. Warning sign number 2, chest discomfort or pressure. Now, everyone gets chest discomfort sometimes. You might feel tightness from stress, or pain from sleeping wrong, or even heartburn from something you ate. So how do you know when chest discomfort in summer heat is actually about your heart? The key difference is this. Chest discomfort related to your heart often feels like pressure, heaviness, or a squeezing sensation. It might feel like someone is sitting on your chest. It can also radiate to your arm, your neck, or your jaw. In summer heat, this discomfort is more likely to appear when you're being active in the heat, not necessarily when you're resting. And here's the important thing. It might not be the same as a classic heart attack you see in the movies. For seniors, heart problems in the heat sometimes feel subtle. It might just be a dull ache or a feeling of tightness you haven't noticed before. What distinguishes this from acid reflux or muscle strain is that it usually comes with other symptoms. Maybe shortness of breath, maybe sweating or nausea. If you're experiencing chest pressure or heaviness, especially combined with other symptoms I'm describing today, stop what you're doing, move to a cool space, and call your doctor or go to the ER. Do not drive yourself. Do not wait to see if it goes away. this is one of those moments where it's better to be cautious. Your heart is trying to tell you something, and you want to get it checked out. The third warning sign is something that catches a lot of seniors off guard: unusual fatigue or weakness. We all get tired, especially in the heat. The summer heat saps your energy. That's just the reality. But I'm talking about a different kind of fatigue. This is the kind where you wake up after 8 hours of sleep, you're well rested, but by mid-morning, you feel like you've been hit by a truck. Or maybe you're doing something simple, tending your garden, walking around the grocery store, and you suddenly feel completely exhausted, like your energy has just drained away. This kind of fatigue, out of proportion to what you've actually done, can be a sign that your heart is working much harder than usual to pump blood and maintain your blood pressure in the heat. What's happening is a combination of things. Your body is losing fluids and electrolytes through perspiration. You're getting dehydrated without realizing it. At the same time, your heart is compensating for the heat by working harder. All of this together exhausts your body's reserves much more quickly than usual. The fatigue feels different from your normal tired. It's often accompanied by a sense of weakness in your limbs, or maybe a heavy feeling. If you notice this kind of fatigue, especially if it's new or significantly worse than your usual summer experience, that's the time to slow down, get to air conditioning, drink plenty of water with a little electrolyte, and rest. If the fatigue persists or gets worse, call your doctor. The fourth warning sign is dizziness, lightheadedness, or even feeling like you might faint. Summer heat affects blood pressure in ways that younger people don't experience as acutely. When you stand up after sitting, your blood pressure needs to adjust quickly so your brain keeps getting enough blood. In heat, this adjustment is harder for our bodies to manage. Your blood vessels are already dilated from the heat. Your blood volume might be lower because you're dehydrated, and your heart is working overtime. All of this means that when you stand up, you might feel a sudden rush of dizziness. The room might spin for a moment, or you might feel like you're about to pass out. This is called orthostatic hypotension, and it's something seniors experience more often in summer. Now, everyone feels a little dizzy sometimes, especially if you stand up too fast. That's normal. But if you're experiencing dizziness that comes on suddenly in the heat, that lingers for more than a few seconds, or that makes you feel genuinely unsafe, that's worth taking seriously. The danger here is not just the dizziness itself, it's that you might actually fall. A fall can lead to broken bones, serious injuries, and a whole cascade of health problems. So if you're experiencing this kind of dizziness in summer heat, the first thing to do is slow down. Don't rush. Take your time getting up from sitting or lying down. Support yourself by holding on to something stable. And if the dizziness is severe or happens repeatedly, call your doctor. The fifth warning sign is where a lot of people get surprised, and I'm so glad you're sticking around to hear this one. It's an irregular heartbeat, or palpitations. Most of the time, you don't notice your heartbeat. Your heart just does its job quietly in the background, and you go about your day. But sometimes, and this happens more often in summer heat, you suddenly become aware of your heartbeat. It might feel like your heart is racing, even though you're sitting still, or it might feel like your heart is skipping beats. Some people describe it as a flutter, like a bird moving in your chest. Others say it feels like your heart is pounding so hard you can see your shirt moving. These are palpitations, and they're actually really common in summer heat because of electrolyte imbalances and dehydration. Here's what's happening physiologically. When you're dehydrated and losing electrolytes like potassium and sodium through sweat, your heart's electrical system gets a little confused. The signals that tell your heart to beat in a regular rhythm get disrupted, so you might have a few beats that are out of rhythm, or your heart rate might spike suddenly. For most people, this is uncomfortable but not dangerous. It usually goes away once you hydrate and cool down. However, and this is important, if the palpitations are severe, if they last more than a few minutes, if they come with chest pain or shortness of breath, or if you have a history of heart arrhythmias, you absolutely need to call your doctor. Do not ignore this. I want to emphasize something here. Palpitations can feel scary. Your heart is doing something unusual, and naturally, your mind might jump to worst-case scenarios. But remember, the fact that you're aware of your heartbeat doesn't automatically mean something is wrong. Many healthy people experience occasional palpitations, especially in heat. What matters is how you respond. Get to a cool place. Sit down. Drink water slowly. Breathe deeply and calmly. In most cases, the palpitations will stop within a few minutes to half an hour. But if they continue, or if they're accompanied by other symptoms from my list today, that's when you need professional help. So, now you know the 5 warning signs. Unusual shortness of breath, chest discomfort or pressure, unusual fatigue or weakness, dizziness or lightheadedness, an irregular heartbeat or palpitations. But knowing the signs is only the first step. What you do when you notice them is just as important. Here's what I recommend you do right now before anything else. If you're experiencing any of these symptoms, the first step is to move to a cool place, air conditioning or at least shade. Get out of the direct heat immediately. Your body needs to cool down, and this matters more than you might think. Second, drink water. Drink it slowly so you don't overwhelm your system, but drink it steadily. If you have electrolyte drinks, sports drinks, coconut water, something with sodium and potassium, even better. This is going to help replace what you've lost through sweating and start to rebalance your body's chemistry. Third, sit or lie down and rest. Don't push yourself to keep doing what you were doing. Your body is sending you a message, and rest is part of the answer. Fourth, if the symptoms don't improve within 15 to 20 minutes, or if they get worse, call your doctor. Don't wait. Don't assume it will go away. And if you're experiencing severe chest pain, difficulty breathing, or fainting, call 911. That's not an overreaction. That's being smart about your health. Now, let me tell you about prevention, because the best way to handle these warning signs is to avoid triggering them in the first place. During summer, check the weather before you go out. On the hottest days, try to stay indoors or in the shade, especially during peak heat hours. That's usually between noon and 3 or 4 in the afternoon. If you do go out, go early in the morning or in the evening when it's cooler. Wear light-colored, loose-fitting clothing. And most importantly, stay hydrated all day long. Don't wait until you feel thirsty to drink water. By the time you feel thirsty, you're already starting to dehydrate. Drink water regularly throughout the day, especially if you're taking medications that affect how your body handles fluids. If you take medications, blood pressure medications, diuretics, antihistamines, talk to your doctor about how they interact with summer heat. Some medications can make you more vulnerable to heat stress. Your doctor might adjust your medications for the summer months, or they might give you specific guidance on what to watch for. This conversation is so important, and I encourage you to have it before summer heat reaches its peak. Finally, remember this. The warning signs I've shared with you today exist for a reason. Your body knows when something isn't right. Your heart is constantly sending you messages. When you learn to recognize those messages and respond appropriately, you're taking control of your health. You're not panicking unnecessarily. You're being proactive and wise. That's the foundation of healthy